This 2-year-old is spending her Friday in the emergency room.
18 kids have died so far, and keep in mind the flu typically kills as many as 50,000 people every year in the United States.
It's only 1 in the afternoon, and Dr. Ron Wall's section of the ER has already seen 8 flu patients.
We went through the sweating, and I was nauseous the entire time.
Cassie's mom, Megan, is especially concerned because Cassie was born prematurely, putting her in the highest risk category for serious complications.
Vanderbilt Medical Center researchers are spearheading the fight against the virus itself.
I guess if I were to explain how the flu vaccine worked in its simplest forms, it's essentially fooling your immune system, the part of your body that helps protect you from infection, into thinking that you've been exposed to the flu. And so once we give the flu vaccine, which isn't actually live flu virus, your immune system is fooled into thinking that you've been exposed to it, so that in the future, if you are exposed to it, you won't get infected.
What a physician scientist is somebody that sees patients, that sees the amazing challenges that patients present, and that thinks not about how am I going to treat this patient, but how am I going to understand this illness.
Dr. Catherine Edwards, professor of pediatric infectious diseases, joined the Vanderbilt faculty in 1978. She has become an international leader in vaccine research, specifically in influenza vaccines and disease. As a successful grant-funded investigator, she has been able to combat the disease now while guaranteeing the next generation of researchers through her mentorship.
My basic work is clinical research, and also I do teaching and I do some clinical care to children with infectious diseases. So my specialty in pediatrics is infectious diseases.
The journey to becoming an independent investigator is a long but rewarding path. Both funding and exposure to research can begin at the medical student level and continue through each stage of training until professorship. Funding to support research ranges from institutional and mentored grants, ultimately leading to independent investigator funding.
I spend a lot of time working with young people, trying to train people so that when I'm in the nursing home that this whole program doesn't miss a beat, that the people that I've trained are better than I am and able to do new things.
I've been extremely fortunate to have outstanding mentors in my time at Vanderbilt, and so I think a part of it for me has been something where they've been incredibly influential to challenge me as an independent researcher and to help me develop my skills. And with that, I think it's important to sort of take as much as I can and learn as much as I can from them and gain the skills. That way, when I begin to ask questions of my own in the future, I'll be able to have the techniques and the basics to be able to do such.
I have a lot of people that I work with. I've had a lot of people that I've trained. There's a bunch of T32 awards. So that is a more junior position, and those are usually questions that you help them formulate.
So Dr. Edwards is my primary research mentor, and what that ultimately means is that I've sort of signed on to work with her, and more importantly, she's signed on to work with me to help to foster my independence as a researcher eventually.
Lee is currently working with me as a fellow. She has a T32. She's working very hard on a very innovative, very complex study looking at avian flu and adjuvants.
The project that I primarily work on is funded by support that Dr. Edwards has received from the NIH. And ultimately, what I do is try to manage the day-to-day conduct of the trial in terms of coordinating the patients, enrolling the patients, scheduling their visits, making sure that the nurses are involved, making sure that the pharmacy is aware that we have patients coming, making sure that the laboratory is aware that we have samples coming in, sort of coordinating all of that. And Dr. Edwards is sort of there every step of the way to make sure, to help me manage all of that and to sort of provide support and guidance for that.
I have been a K-mentor to a number of people. What the trainee does is that they formulate a series of aims that they need to do in the project. And so Ks are more advanced. I was Dr. Halas's K-mentor.
When looking for a fellowship, I knew that I wanted to do clinical research and pursue a master's in public health. And I was searching for a mentor that was successful in clinical research and vaccine studies. And that was the reason why I chose to come to Vanderbilt, is to be able to be mentored under Kathy Edwards.
Well, Dr. Griffin is a senior epidemiologist, and she's a colleague and as a professor. And
partly based on our studies, the CDC decided to do a big multi-center study where we would enroll children and when they came to the hospital and actually test them for flu so that we could really determine directly how many children were being hospitalized for flu. And that was when I started working with Dr. Edwards, because she and I worked on that study together.
My expertise has been a little bit more in establishing surveillance systems, although she's been doing that recently too, so that when we started out, getting the surveillance systems up and running and those sorts of things were ways that, so we worked together on those, and I think those are really peer relationships, so that we're colleagues and we respect each other for what we do. And I work on her grants and she works on my grants, and and so I think she has had less. She doesn't really study the vaccines in terms of clinical trials, giving them to people, but she looks at their impact. So there's sort of differences in terms of what we do.
And partly based on those studies, over the past 10 years, the recommendations for flu vaccine in children have really expanded.
Dr. Crow is a bench scientist, the kind of person that actually does the work, most of the work in the laboratories.
I principally work on trying to understand how the human immune response to viruses occurs and what that can teach us about how to design vaccines.
So he is somebody that I work with by providing samples from the studies that we do for his studies.
Kathy predominantly does what people I think would term clinical research. I have more of a basic science flavor and translation. So it's been a great relationship for us because we come together in the middle, and I can bring the laboratory techniques and assays and some of the finicky things that are tedious to projects, and she can get it done in the clinical realm.
He is a very unique basic scientist that I love working with because he appreciates that what I do to get the patients that he needs to study is hard, and that he respects that that I am providing something to him that is quite unique.
It's not trivial to understand the regulatory business, work with the people who make the vaccines, the safety testing, consenting, just the logistics of getting people in and out. People sometimes don't have phones and cars. How do you deal with that? I mean, this is an entire area of science around study design. She brings that, we bring the laboratory piece, and we both have common interests. I think we've been a great team together.
This is Max. He's almost 2, and when he was about, 9 or 10 months old, he was in Dr. Halas's flu study. I was really interested in having Max be a participant in that study. The majority of what we do in clinical practice is not based on research findings, it's based on our best guess. And there's so many times when we're faced with a clinical decision where there's one of 2 or 3 different things that we could do to a patient and we don't know what the right thing is, and that's really where research comes in. So we only study things when we don't know what the right answer is. And so I think learning about that really kind of spurned my desire to actually be a participant in clinical research studies.
Sometimes I think that vaccines aren't sexy. Obviously, we are one of the best vaccine centers in the country, and probably the man on the street wouldn't even know that. So I guess we're the best when there's no disease and nobody knows what we're doing.
And I think the challenge of flu vaccine is there's a lot out there and a lot of misperceptions about it. And it's really a safe vaccine. And I think what I see is when we come into work and we say I'll stay home if I'm ill, we don't do that. I won't know when I'm shedding virus. And so getting vaccinated as well as washing hands and doing all those things to prevent the spread and harm to our patients, to our family, to each other. So I kind of try and balance it as a patient safety choice. And that's kind of why we went into the healthcare profession and not other places. That's part of our duty, honestly. That's what I believe.
I think in terms of vaccines, I have a major role. I mean, I have a very large NIH grant to study vaccines. I have a CDC grant to look at vaccine safety. You know, a lot of my time I have to spend understanding, are there adverse events? What are the adverse events? What are the mechanisms, or are there not? I also have some grants to look at burdens of disease. It's very exciting to see something that you have done has made an impact on a whole generation of patients. I mean, that is very exciting.
In order to have the broadest effect, I had mentors who convinced me that working on vaccines was most likely to affect the largest number of kids in the developing world. So I ended up in vaccine research, and as the years have gone on, I've transitioned from making and testing vaccines, which is somewhat empiric, to figuring out how does the body even work so that we can rationally design vaccines.
Well, I think you have to have a passion for what you do. I think you have to really find what you do stimulating, that it continues to push you to ask new questions, that to never really be satisfied with the answers that you currently have. I think it's you always have to ask why.
My main advice would be, besides finding the right mentor and being in the right environment, that it's really important to have passion for what you do, to be a very hard worker, and always be persistent and never give up.
Yeah, so Palooza was a big campaign chaired by our occupational health group, and we partnered with them and other groups, and it was designed to do a couple things. One is, in the event that we ever have a pandemic, test our ability to rapidly vaccinate as many people as possible, and we were pretty successful. We broke the world record. But the ulterior motive is, while we were testing it, we actually gave a lot of people flu vaccine, which is good and important. And my mission and my interest in this is that preventing infections in each other and our patients. So we go and take care of other patients. We can shed virus, and so getting vaccinated is a key part of that. So using things like Palooza to try and improve vaccination is important, and evaluating that academically and scientifically to add to the literature about what do you do in a pandemic and how can you make something like that run efficiently is important too.
If we simply follow the cookbook, we're not going to get where we need to go, and that's what drives me. It's the fact that I've seen the patient with H. flu die, and I did all I could at that point, but what was really needed is an understanding of the organism, of the host, how you get a host to respond, what is protective, and how to prevent it.
Its name was Enza. I opened the window.